Ladies and gentlemen, please welcome Pikeville Medical Center President and CEO, Donovan Blackburn.
Well, good afternoon, everyone. On behalf of Pikeville Medical Center, it is certainly my privilege to participate in the 2024 SOAR Summit like we have since its inception. For now a decade, the SOAR Summit has been an event where ideals have been born and challenges overcome, while also recognizing and spotlighting that healthcare is our regional's leading industry, both in economic impact and in employment. Over the past several years, numerous announcements at Pikeville Medical Center has led to major capital investments, spawning new world-class medical services, state-of-the-art equipment, and new technology, while also creating many new jobs and career opportunities. Many of these investments are thanks to the financial support and leadership of our state and federal partners like ARC's Gail Manchin, U.S. Congressman Hal Rogers, and Kentucky Governor Andy Beshear, Senate President Robert Stivers, and House Leader David Osborne. We at Pikeville Medical Center are extremely grateful for the continued financial support that has led to the new infrastructure projects, creating numerous healthcare educational offerings and partnership opportunities, allowing us to expand our allied health programs to address the workforce shortage. It is easy to see that the provided funding has already significantly enhanced the opportunities to create new jobs in Eastern Kentucky for Eastern Kentuckians, while allowing us to improve the quality and capability of healthcare for the sickest of the sick and the most financially challenged citizens in our nation. PMC, ARH, UK Health, and other healthcare organizations across our region have and will continue to work, as you will hear more later in the program, to offer more access to care to overcome many of the workforce and healthcare challenges that we have and continue to face. Like PMC and ARH and other healthcare providers, many industries represented here today continue to struggle with developing a trained workforce to meet their needs on both today and tomorrow. PMC, with the organization and partnerships like with SOAR, UPike, Galen, Big Sandy, ANU, KHA, and many others, is proud to be leading the state with our new workforce development initiatives and is seeing amazing results from Project HEART. Project HEART is healthcare employment around regional training, which stands here today, is not just an initiative, is a beacon of hope. It began 6 years ago as an ideal discussed over dinner during a SOAR summit between myself and Congressman Rogers. By the end of the dinner, we had a plan and agreed to march forward. Then when I presented HEART to the newly elected governor, Andy Beshear, just weeks after he took office, I immediately had his support as well. Over the past 4 years, it has become a top initiative for folks like President Stivers and Speaker Osborne, along with Senator Wheeler, Representatives Blanton, Lafferty, and McCool, understanding what this means to our region. It has quickly grown into a concentrated effort to combat the staffing shortages in nursing and allied health programs that still exist today. Over the past year, the growth of Project HEART initiative has been nothing short of remarkable. It increases exponentially, both in speed and the number of organizations that chose to participate. It quickly expanded beyond its regional target of nursing shortage, soon encompassing even more healthcare careers and creating amazing job opportunities. The Project HEART initiative now consists of several colleges, technical schools, and this university, and has either created or expanded programs to help educate and train more healthcare professionals than ever before. By offering financial assistance, we have gone from only 35 healthcare seats over the last few years to over 550 allied health programs and nursing programs here in Pikeville alone with higher ed. This is allowing Kentuckians to stay at home, be educated at home, and work at home. Our region also plans to lead the nation by yet another example of this keen vision. With Governor Beshear's endorsement, his cabinet has been working with Pikeville Medical Center and a host of others, including the Pikeville Independent School System and the Pike County School System, to launch its first LPN program in schools this fall. This will be a first of its kind in the nation. This will give these students the opportunity to enter the medical workforce as an LPN, or shortly thereafter, higher ed timeline towards a pathway to becoming an RN. As you can see, Eastern Kentucky continues to overcome obstacles associated with healthcare training and educational opportunities. In a recent project led by SOAR, Eastern Kentucky Runway, I'm proud that PMC is a component of that project to provide many new technical positions besides nursing. Through this program, PMC will provide training programs to address the region's skilled healthcare professionals' employment. Through this program alone, we have committed to hiring new OR techs, medical office assistants, medical assistants, patient care techs, medical laboratory techs, radiology techs, and registered behavioral technicians, ensuring a seamless transition from students to employee. We created jobs while working with higher education to develop long-lasting career opportunities. Another example that our workforce future is indeed bright. Pikeville Medical Center has been blessed to survive and thrive with the help of our governmental and legislative and educational partners. Our successes have impacted the lives of employees, communities, and the region. Together, we can and have transformed our ideals into realities, our dreams into actions, and our actions into legacies. The future is not something we inherit, it is something that we create. In closing, I wish to thank Colby and his amazing staff, President Stivers, Leader Osborne, Governor Beshear, and my friend Congressman Hal Rogers for their work as our elected officials and for leading our region in a strong manner, for their unwavering faith and continued support of Pikeville Medical Center, the medical industry, and the 54 counties that SOAR represents. Thank you.
Are y'all getting tired of me yet? Don't answer that question. Thank you, Congressman Rogers. It's my pleasure to be able to introduce our next guest for today. We have the chair of the University of Kentucky Board of Trustees, Dr. Brett Brockman, and the president of the University of Kentucky, Dr. Eli Capilouto. If you please come up, gentlemen.
Thank you, Kim. On behalf of the UK Board of Trustees, it is my honor, along with President Eli Capilouto, to join you this morning. I'm so pleased as well to be with our partner, Donovan Blackburn, President and CEO of Pikeville Medical Center. President Capilouto and I were with our Board of Trustees in Lexington earlier this morning. As we wrapped up our annual retreat, our board members send their warmest regards. They also wanted to send a message. Your university, Kentucky's university, is committed to partnering with SOAR, with communities and policymakers throughout this region and state, and with healthcare providers to advance the health of Kentucky together. We made a commitment today as a board. We want to do more than any other institution in this country in partnership with you and others to advance the health of the state we serve. That means treating and healing more people closer to home. But it also means working with you and communities to create jobs, train and educate more people, and help ensure vibrant communities. We can do much, but we can do so much more together. We have much to learn from SOAR, from policymakers, from providers and leaders like Donovan, and from other providers. You know deeply your communities and their needs. You bring sources of innovation and perspective to this goal of advancing the health of our state. The cornerstone of this commitment was the announcement this morning by our board endorsing the implementation of what we are calling Advancing Kentucky Together Network. This network will begin with an investment in resources and intellectual property by UK Healthcare to establish a new model of an advanced affiliate network to support and strengthen clinical partnerships. I am proud to announce that Pikeville Medical Center is the first member of this network, the Advancing Kentucky Together Network. We hope to grow this network over time to include other healthcare providers, community partners, and others, because health is treating disease and preventing illness, but health of our state is also about its economy, workforce, and quality of life. Together with dedicated partners like you and others, UK can help advance the health of Kentucky. Today's announcement is recognition of the fact that we all share a deep commitment to making Kentucky healthier. Our goals: keep patients closer to home when possible and appropriate, support the education, retention, and recruitment of Kentucky's workforce, extend UK resources and expertise where partners want us to help in preventing illness and improving health outcomes, as well as increasing opportunities for Kentucky's workforce, and collaborate with partners and communities in ways that improve an organization's ability to track health outcomes and grow clinical services for both UK healthcare and our community partners. I'm so pleased that you are the first to hear about this exciting announcement, so thank you. We look forward to working together to create a healthier Kentucky for everyone we serve. I will now turn it over to President Eli Capilouto for a few words. Thank you.
Thank you, Chair Brockman, and thank all of you for being here. And on behalf of the University of Kentucky, it is indeed an honor to share with you a little more about the progress that Chair Brockman spoke to. It's about our work together, because we know that our commonwealth depends on our common health for our common good. And I know I see many of our partners here today, some on my way in who are no longer with us, but I feel I must acknowledge them because we are here to support them and work with them as partners. Of course, Congressman Rogers, Governor Beshear, President Stivers, Special Advisor Rocky Atkins. And then I was glad to get here in time to hear the inspiring words of Co-Chair Gail Manchin. And I'm always moved when I visit this campus and its leadership under Dr. Burton Webb today, and always pleased to see Governor Patton on my way in. But for Congressman Rogers, I don't know if you recall, but it was about 13 years ago, about this time of the year when I arrived in Kentucky. I visited you at the Center for Rural Development, and I now know what the Israelites felt like when Moses came down from Mount Sinai. I don't remember all the 10 commandments you gave me, but I remember 2. And here's one. You told me to plan the work and work the plan. And then the second thing I recall is you looked at me square in the eye and said, remember, you are not the president of the University of Lexington. And that is so true. So it's in that spirit of partnership and with the promise of what it means when we work together that you just heard from our board chair and their approval this morning of a bold step forward in our mission to improve the health and well-being of all Kentuckians. The Advance Kentucky Together initiative is based on conversations we've had over several months and experiences we've had over the past decades so that we could more directly address health, education, and workforce needs facing our state, working with many partners like the ones who are here today all across our Commonwealth. We plan to invest millions of dollars in partnerships that improve prevention, access to health care, outcomes. We'd like to work to elevate and expand workforce training and education and do everything we can to advance the health of the Commonwealth. This is not just a plan, it's a commitment. It's a commitment to ensure that every Kentuckian has a fair shot to better health and an improved quality of life. We are committed, as our chair said, to working with partners to do more than any state institution in the country to advance the health of those we serve in a state that we love. That is our ambition, that is our mission, and that is the goal we aim with you to achieve on behalf of all of those we serve together. Over the past 20 years, our health system, UK Healthcare, has established dozens of affiliations with community hospitals and clinics across the state to improve access to specialty care in areas such as cancer, heart disease, and stroke. Our goal then, as is our goal now, is to keep people close to home for the care they need when they need it. But we can and we must do more and be more for the citizens of Kentucky. And in that vein, I'm going to ask Donovan Blackburn to join me on the stage, as the chair just announced. Pikeville Medical Center is our first partner in the Advance Kentucky Together network. And I want to thank Donovan and his entire team at PMC for this work. And I want to thank you for participating in our board retreat yesterday. For those of us who were there, your compelling words about the people you serve in this region moved all of us. So thank you, sir. Thank you. There is a great deal we can do as a medical system at UK, but we also have a lot we can learn and more to do together by partnering with a strong community provider like PMC. So we can do so much more. But the key, the power here is the idea of we. We, what we can do together, what we can make happen in this region and across our country and Commonwealth when we come together. As I mentioned, this initiative is going to go beyond just patient care. We stand ready to work with partners across Kentucky to address workforce development, education, and community outreach. We need a workforce not only prepared for today's jobs, but those jobs that we have yet to even imagine. And our network will also enhance community outreach, bringing much needed health education and services to more and more Kentuckians. And by providing resources to local partners, we will ensure they are better equipped to meet the needs of their communities. And at the same time, we will learn from them and build a knowledge base that will inform us, inform all of us across Kentucky. At its core, the Advancing Kentucky Together network is about partnerships. It's about trusting relationships. It's about coming together on behalf of those we serve to ensure that health care in Kentucky is not just reactive, but proactive. And it's not just localized, but it's coordinated. And it's always focused on improving the lives of those who need it most. So I want to thank our Board of Trustees for shaping this vision that we share with you today. Their dedication to the health of this state is palpable, and their support is invaluable as we move forward. And to all of our partners over the past decades who pushed us to never dream too little dreams and showed us how to make those a reality. I thank you. We are deeply grateful for your partnership in this important work, and we look forward to continuously learning from you and with you as we build on our strengths together. I hope this is the beginning of something powerful, something new, but I think it's built on an enduring promise from 160 years ago when the University of Kentucky was founded. And that is the promise to answer the call to advance Kentucky, to make for a healthier, wealthier, wiser Kentucky. And we're honored to have you as our partner. And Congressman Rogers, this is what it means to be the University of, for, and with Kentucky. Thank you for your inspiration. Okay.